campaign and all the tools that are available. And then we also have engaged the mobile money providers. We have the contracts available, contracts signed ahead of time, as well as opening up the mobile money wallet that's going to be used to disperse the funds to the workers. Then now it's time for campaign. So the campaign period, we essentially focus on two things. Number one is registering workers who are not previously registered or captured on the database. And number two, which is, I would say, arguably the most critical and difficult part, which is validating the attendance of workers. So we have set up tools to register workers, but we've also set up tools, as Demagi will present, on how to do the attendance validation. We all know that attendance is what determines payment. So you have the worker selected, you select their role, you select the number of days they've worked. You also ensure to validate that against the budgets that have been approved, to ensure that we're not overspending on any area or category. And so this then goes through rigorous checks in the back end by WHO. We use tools to sort of validate that we're not exceeding any budgets based on what the ministry had submitted to us. And so that takes place over the course of the campaign. So as soon as the campaign is done, we've accounted for all the workers, we've validated their attendance. So now we move to post-campaign, which is paying the workers. And this is very important because we started this initiative where it was taking us 30 days to pay people. But us as WHO, we sort of set ourselves the benchmark of paying 95% of workers in 10 days. That is our goal when we first started. And you'll see in some countries we have been able to do that for the most part. But the idea is that we've sort of shortened that payment timeline, but also make sure that it's not just paying people, but also there's exceptions that come up. Sometimes someone will say, I provided the wrong number, or I failed the KYC verification, or we accidentally put 3 days instead of 4 days. These are all of the exceptions that are being managed in the back end, but we also prioritize payments for those that are ready and good to go. There's nothing wrong with their data. And so this usually takes place, depending on the country, anywhere between 5 days to 20 days. In Kenya, in the last campaign that I was managing, we paid 100% of workers in 10 days post-campaign, and that was across 4 counties in Kenya. And so, like I said, the payment timelines vary. In countries like DRC, it's the benchmark for us, it's 30 days. You know, you can imagine how much worse it was before that, but the goal is different for every country, taking into consideration the country context as well as the ecosystem. Then the last stage is also we need to routinely evaluate and monitor. So we want to make sure that the system that we designed is a best fit, not just for the country, but for the workers themselves. And so we worked in collaboration with various partners to assess the campaign workers' experience. This gives us an opportunity to hear from the field how workers are engaging with the system, and whether or not, you know, they have any pain points, anything to consider, so that it can help us guide us when we need to improve the system. And the surveys really puts the beneficiary's voice at the center of our approach. And so really it's given us a lot of insights into how these health workers are feeling about this switch to digital payments. So I've touched briefly on the roadmap, but we also should note here that the DFT works through partnerships. It's not just WHO that's doing this. We have a whole robust profile of partnerships that help us build the system, roll it out to also maintain it. And so I think I briefly touched on some of them, but just to do a bit of a refresh, we have the WHO country office. So this is a regional initiative, but when I go to the country, I engage with the country office. so that they can bring together all the stakeholders and provide support in the back end to process payments from the country office if need be. We have the most important partner in this, which is the Ministry of Health. The Ministry of Health is the driver of this initiative. WHO believes that, this system belongs to the Ministry of Health. They should manage it, they should own it, they should routinely update it, but with us providing some level of support in the back end. So the ministry is the end beneficiary of this solution, and they work with us very closely to sort of validate our approach and to also give us guidance on what's feasible and what's not feasible. So essentially we are equipping them and giving them the ownership to manage the system on its own. We then have also Damagi here. They're the main developer of the app ComCare that's been used for the enrollment, also attendance validation, basically developing all of the digital tools and the workflows to manage the entire digitization process of payments. We also have mobile money operators. We currently have over 30 contracts with various mobile money operators in the African region. And so what they do is they help us, again, do the KYC verification of all of the workers that have been registered, as well as allowing us to use their infrastructures to sort of initiate those payments to frontline workers. And on the impact measurement side, when we're talking about those surveys and evaluation studies, we have 60 decibels. So 60 decibels has been working with us to sort of develop those surveys for specific countries and issue and tailor the surveys as well. I believe we now have 6 studies available on their website if you'd like to go and review them, to really hear from the health workers, their experience, as well as any areas for improvement for WHO as well. On the research side, previously we were partnered with Harvard as well as Macquarie University and University Sheikh Anta Diop de Dakar. And so they help us, these research institutions help us harness our research in areas around digital payments. And so the research really informs as well our process on how to sort of have best practice measures when it comes to rolling this out and scaling it as well. On the capacity building side, we've partnered with the Digital Frontiers Institute. The idea is that we just don't want to set up these tools, but we want to equip the Ministry of Health workforce, as well as the WHO country office, with the tools and knowledge around digitization of payments. And so we provided scholarships and courses to various ministries of health staff, as well as to WHO country office staff on taking courses on digitization of payments for health workers. And so this really equips them with the knowledge and skills so that if they need to perhaps manage these systems in the future, they can take that into consideration as well. And essentially, all this is gearing up so that we can do a full handover or ownership of the entire payment process, tools and systems to the Ministry of Health. That is the end goal here. In some countries, we've started to initiate that process. In Côte d'Ivoire, which is the first country where we've launched, we're now in the process of handing over the database as well as the mobile money wallets and the tools for the ministry to manage this themselves in the future. And there's currently a portfolio of countries that are preparing for the handover as well. Okay, so now let's talk a bit about our footprint. So we started in 2020 in 3 pilot countries. We had Côte d'Ivoire, Mali, and Ghana. And then over the years, because of the demand for payment digitization, we've demonstrated that we were able to do it. We got a lot of interest and demand from various other countries. So we expanded the scope to an additional, I'd say, an additional 27 countries in the region. Keep in mind that just because these are the years where these countries kind of started implementation doesn't mean the implementation has stopped. All of these countries to some extent have ongoing implementation to some degree. Some are advanced and some we just started in 2024. We had Guinea and Angola that are still at the very early stages. We also try to align the selection of the countries based on polio priority as well. So wherever polio is a priority is where our priority is as well when it comes to digitization. But since then, in a lot of these countries, we've received some demand for support on other programs such as malaria as well. As when in Tanzania, we had a request to support them on the Marburg virus as well. So far, 30 countries. So with this in mind, what have we achieved? So since 2020, we've managed to build capacity of tens of thousands of Ministry of Health personnel, and it's not just Ministry of Health personnel, it's also community health workers who we've trained routinely, we've invested, we've had them sign up for various courses on digitizing payments, but where a lot of this comes in is the training that we've done. We've done a lot of training on how for them to manage the tools developed by Comcare, and so we've managed to have a robust workforce of health workers that can now engage in some capacity with digitizing payments for campaigns. We have over 2.6 million health workers enrolled in 29 countries in a complete and verified database. And like I said, these databases are not just for polio, but they could be used for a variety of health campaigns and intervention. We noted that people who are in databases for polio are also in databases for other health campaigns as well. So these databases that we've built are very cross-functional and can be customized for the specific activity as well. We've just recently hit the 3 million mark, so we're over 3 million polio workers that have been paid digitally using mobile money. We've supported, in that facet, we've supported over 98 health campaigns as of yesterday. We had Kenya that start today. And in 22 countries with a 99% success rate at first payment attempt. Now we also say 99% because there's a small percentage of payments that, for whatever reason, fail or don't go through, or at the first attempt, maybe the number is not active. So, but we've done the research and it's indicated that it's 99% success rate at the first payment attempt, meaning the worker almost always instantaneously gets their money on time. We've seen a significant reduction of payment lags. We have in some countries where workers are paid as early as 2 hours post-campaign. We had that in DRC, and I think we had that also in Côte d'Ivoire as well, where before even the campaign was over, the workers, as soon as we received the attendance, and we verified the attendance, the payment was made available within 2 hours post-campaign. We've also increased transparency and accountability with a full audit trail of payments. Now, the good thing about digitizing payments is that we can track the payments. We know exactly who was paid for how much. The previous system was a bit murky when it came to that. We weren't able to determine if the payments went on time. It also makes it, from an accounting perspective, much more seamless to do your reconciliation month end to ensure that all the funds have been accounted for appropriately in case there is an internal or an external audit, and they require that information as well. So with all this, we've managed to really save the credibility of WHO, which was at risk previously. We've managed to enhance the satisfaction of field workers and have the improved image of WHO with field workers. Now, it's important, I cannot understate enough how important it is to focus on the satisfaction, the campaign satisfaction, because these workers, we've seen a trend where if payments are delayed, they will not be willing to participate in any campaigns going forward. And so this really makes it difficult for WHO to mobilize in an emergency setting, to have a full workforce of people available to support campaigns. And so now we're seeing a bit more enhanced satisfaction, and so we're seeing less and less turnover between campaigns, and workers are routinely signing up for campaigns because they've rebuilt trust with them when it comes to payments as well. So what are quickly the challenges? So we have the very the real essentially reality that there's remote and hard to reach areas in the region. We have areas where there's no network coverage, lack of mobile money agents available, and so before we go into any country, we sort of assess the ecosystem as it is. And so we have to ask ourselves, is it feasible to roll out a digital payment system in a region or a country where there are no mobile money agents or there's no network coverage, where the worker will have to travel long distances to go collect the cash? So these are questions you have to ask yourself, and it's not always feasible. In some countries, like in DRC, we started small and we scaled bigger and bigger, depending on whether or not the area is susceptible to this initiative, or to this, this initiative. And so that's a challenge that we face. We, I guess, prioritize areas where we do have a robust ecosystem, and where there isn't an ecosystem, we see if there's ways around it to navigate those challenges. And then we have the advocacy and buy-in. This is very critical because without the support of the Ministry of Health, we cannot get this off the ground. That's the truth. We have countries where we've encountered resistance, and the ministry is not really doesn't really believe that these solutions are going to result in positive changes when it comes to payments. There's a lot of also there's a lot of reluctance a lot of the times, and so what we find is we focus our efforts in advocacy by demonstrating our successes in other countries and other areas. And so we've seen governments now come around and say, okay, WHO, you've been doing this for 3 years, and you've demonstrated a certain level of success, so we're inclined to maybe pilot this in a specific region or various regions, and then we can see if we can scale. And some other countries, they give us the green light right away. Like in Tanzania, we did a national campaign for polio, and we paid everyone with mobile money. So advocacy and buy-in is at the very forefront when you're starting this initiative, is where you need to sort of place a bit of emphasis. There's also no harmonized approach from health partners. We have a situation where we're all working to eradicate polio as partners, but WHO is using mobile money, UNICEF is using cash, we have the Global Fund that's using mobile money and cash, so there isn't like a very harmonized approach when it comes for partners to coordinating on these issues. And it's very critical because when we approach the ministry, we want, especially as UN agencies, to be harmonized in how we do these payments and how we roll this out. And so a lot of times, when you have no harmonized approach, it creates a risk whereby you have separate databases, you have separate tools, there's no cross-correlation when it comes to like initiating payments, and this a lot of the times creates duplicate processes. So I'll give you an example. In Kenya, we have UNICEF and WHO that do jointly the polio campaign. WHO does specific activities and UNICEF does other activities. And so when it came time to payments and registering workers, we were getting ready to pay for a specific activity. I think it was training of the vaccinators, and we got a list of all the workers on the database. And at the very last minute, we realized that these same people that are on this database for this activity are on the UNICEF database for another activity on the same days. So essentially, you have one person who's trying to work 2 roles and collect dual payments on the same day, which is not really what you want to encourage. And so the lack of harmony between the payment processes makes it very difficult for us to ensure and to manage that we don't have people that can potentially defraud the system in any way. And we also should generally be on the same page when it comes to digitizing payments and encouraging its use. We also should discuss the resources that are limited to the polio program. So there is a capacity problem, which means that, our team specifically is very limited to polio. We are only one team, and this was started as an entry point to polio, but now we're getting requests from different organizations. We have now the Global Fund started a partnership with a WHO on digitizing payments for malaria. They want to use our system, but keep in mind, it's not as simple as it sounds, because you have to consider the capacity, the constraints when it comes to resources that can really hinder our ability to scale this nationally and scale it to other programs as well. So that's been a huge challenge, but we are putting a lot of human resources, funding as well, to ensure that we can sort of fill that gap. So last slide here, just wanted to quickly brush over the experiences from health workers. So these are some of the surveys that we've done. You'll see that there is a recurring theme in that all the 3 countries that we've done a survey in, and these are just 3, I believe, out of 5, Cote d'Ivoire, Liberia, Republic of Congo, we see that overwhelmingly, workers prefer mobile money to cash. Now, the question of why differs, but we can see that the key takeaway here is that workers see the value in how secure this mode of payment is. When you're giving someone cash, there's that level of hesitancy of, oh, is this the correct amount? Did some cash go missing along the way? And so on and so forth. So mobile money really provides that ease of mind when it comes to receiving your money securely. There's no interference in the process. It goes from WHO, sometimes in other countries from the ministry, directly to the pocket of the worker, and you get an SMS as well. You see that also they really value payment timelines, and that's again demonstrated here, and also really setting the expectations through communication. So a lot of workers were really pleased with the fact that we are reaching out and seeing, from them, how can we better improve this, but also mobile money gives you an opportunity for dispute resolution, to say that if I haven't received my money, this is the number that you can contact, this is how much I've been paid, and so it kind of sets their expectation by, improving and enhancing communication as well as payment timelines, and how much money they should expect to receive as well for their work. So yeah, so I think that's it for now. I think I've gone over a bit time, but I'll just see if I can take any questions before we jump to our next presentation by Damagi. Okay, I guess you're up.
Great, thanks. Awesome. Hi, everybody. My name is Mary. I'm Director of Technology at Damagi, so I'm definitely more on the software side, but I'm excited to sort of show you how this looks in CommCare. I'm going to share a lot of newer functionality that we've been developing based on our feedback working with WHO on the polio payments programs. So a lot of feedback around how this should work in CommCare directly has led to some new development. So CommCare, just as a quick overview, is a digital platform that enables you to build your own mobile applications. We have both a web version, so I'll show you quite a bit of functionality on the web version, and that's where an administrator might work to design the program, to do activities like data cleaning or running reports. And then community health workers will use the mobile application to conduct their campaign activities. They would run enumeration of their campaign. There might be supervisors that are also overseeing the campaign. It's a no-code platform, so any administrator can build an application on CommCare and deploy it without any programming skills. And it's an open source tool, a global good. So happy to talk about it more in detail, but I wanted to just emphasize that there's both a web application, which is where some of the functionality that we'll look at today is, as well as a mobile app. So I want to specifically talk about how we're using CommCare for campaigns, and I'll walk through sort of the general overview of specifically how this has worked on a lot of the polio campaigns. CommCare has been used on malaria campaigns, polio campaigns, mass vaccination, COVID campaigns, so it's a really flexible solution, but as we said, we'll focus specifically on the polio workflow. So I'll actually start over here with the campaign manager. So this is a supervisor who's overseeing the activities. She's often working on her mobile device and is overseeing the enumeration of the campaign. So she's the one who's enrolling workers, she's tracking attendance, and she's ensuring that the campaign worker is conducting their activities. So both of these folks are generally working from the mobile application. They're conducting the campaign activities, perhaps they're vaccinating folks, and as they are collecting data, once they have connectivity, so they can work in an offline mode, once they have connectivity, the data is synchronized up to the CommCare server. That's where we can do activities like checking for deduplication, we can run reports, we can build dashboards, we can sort of validate the activities that were conducted, and that's where we make the connection with mobile money operators as well. So often it happens via report. The way that we integrate with different mobile money providers varies based on the structure of the mobile money providers, which we'll talk about a little bit more. But from here, the mobile money administrator triggers the cash payment to the campaign worker's mobile wallet. So I wanted to provide this just sort of as a something we can keep in mind as we talk through some of the demos that I'll share. So I'm going to go through 6 steps of campaign, specifically the parts that we focused on digitizing. I'm going to share a series of videos, mostly because I'm just getting nervous doing a live demo. I wanted to make sure it all worked. So I'll share a series of 6 videos that show each step in CommCare. But our first step in our campaign is to put together the micro plan. So in this case, we have a wide range of getting information about where households are located, and that information informs the campaign activities. So we might get that information from a previous campaign, from electronic community health record system. We might upload data from the Ministry of Health. We might use open source data sources. But essentially, we gather all that information, we upload it into CommCare, and then we look at the information geospatially to design the campaign activities. And the design is intended to optimize campaign coverage. So I'll go ahead and play this. So here we're in the CommCare HQ, the web version, and here you can see the location of a number of households. This is test data in the country of Benin. So the gray dots represent households, and the blue dots represent the physical location of where we have campaign workers recruited. And there might be a case where I want to highlight just the workers and the households in a specific region, so I can kind of draw that information on the map. I can also look at different layers on the map, so there might be a case where I want to look at geopolitical boundaries or like rivers that might inform the way that we're designing our microplan. But once we've selected a specific area and clicked Run Disbursement, the households are assigned to the mobile worker that is most closely located to them geographically. We know that computers only can do so well, so there is an option for an administrator to override what the system has suggested as a starting point, so they can sort of tweak which households are assigned to which mobile workers. And once we're satisfied, we can click Accept Results down here. I know it's small, but this is essentially sending the mobile worker a list of households which she will plan to enumerate. So the idea here is that we can suggest in the system the fastest way to go through all of the activities that are planned in a given campaign, and those show up on the mobile worker's phone as a work list. So when she opens her device to start her enumeration activities, she has a list of the households that are most physically or geographically closest to her, based on either the road availability data, or just kind of proximate. Sorry. Okay. So then we start our campaign activities. So we want to recruit and enroll workers to actually execute the campaign. Based on the scale of the campaign, we know that we might need to recruit a really wide range of workforce sizes. This could depend on the number of folks available, if they've been trained for a previous campaign, where they're geographically located based on where we're conducting enumeration. But we want to conduct training activities to make sure that they're prepared to execute the campaign objectives. This might be done digitally, it might be a virtual training, it might be a train the trainer activity. But during this phase, we enroll workers and verify them, and I'll show you a little bit more about some of that verification that we can do. And we also track the attendance here. So in this case, a supervisor is often working on another application, and that the supervisor each day can log on and indicate whether what role individual worker is playing and whether they're conducting activities that day. And that information, as we talked about, is used to calculate the compensation that they're owed for the end of the campaign. So we talked about this a little bit already, the KYC validation. This is a really important step that we've started to build directly into CommCare because we want to ensure that mobile workers who are enrolled to conduct activities are prepared to receive payment. So we want to do that Know Your Customer check up front before they start conducting enumeration activities at that point of their registration or enrollment in the campaign. So go ahead and show, I'll just pause this first and orient us. So again, we're in the web application of CommCare, so someone would log in on their laptop. Here we see a list of all the mobile workers who have suggested that they're available to conduct activities for the given campaign. We have when they're registered, and we can also customize this to have a little bit more demographic information about who they are. So then we can go over into a specific KYC report. So we'll scroll down over here, select the Know Your Customer report. It's loading. Okay, so here are each of our mobile workers, and we can click Verify for one or many of these mobile workers. This is all test data here. So if we are not able to verify a worker, we get a failure message, and we can see there might be a network error. But if we pass, then the worker is marked as verified. I will show you a screenshot of this because I know it went by fast. So essentially, you're able to select one or multiple workers to verify, and the system indicates whether this person has not been checked yet, if they fail, or if they pass the KYC check. We can customize the demographic information that we have here. This is, again, just test data. But this ensures that we're able to, before someone starts conducting activities, check that they're able to collect payment for that work. Once a mobile worker has passed this KYC check, that information is transmitted onto the mobile device so that we can understand which mobile workers who have showed up to conduct activities are able to receive their payment. So then, I know it's a lot of preparation, but then we get to do the fun part of enumerating the campaign. So workers and supervisors conduct their activities. This might be dispensing vaccines, it might be providing nutrition counseling, conducting malaria spray campaigns, but they're able to both work in a supervisor application, they're able to kind of track progress directly on their mobile device, and there's a lot of different ways that we can customize that interface on the mobile device to conduct enumeration activities. There are a couple of things that are specific to CommCare that I just want to call out with regards to the enumeration activities themselves. It's possible to do a lot of these activities with a biometric integration, so if we want to register households or check individual workers with either a fingerprint or a palm scan or an iris scan, that's possible. It's possible to communicate with our workers via SMS or WhatsApp integrations, and it's also possible to integrate with national birth registries in cases for things like vaccination timelines. So this brief video just kind of shows what the user experience might be like for someone who's conducting a registration of a new household during enumeration. There's a lot of validation in these fields. We can kind of customize the iconography, the language, the text forms, things like that. There's a lot of different types of data input questions. So in this case, we have a pictographic calendar date. There's validation on each of these fields. So for example, we're conducting a campaign for children under 5 and the date is entered and the child is 7. The system would sort of pop up with an error there. Same with the phone number being localized to a specific context. Great. The next really important step for the campaign is really tracking and adapting the progress of the campaign based on the data that's collected every day. I know a lot of the sessions this week have discussed sort of this as a main value add of digitization, the ability to really monitor and adapt in real time. There's a lot of different ways that folks can do that in CommCare. We see a lot of folks monitor the progress of a campaign directly in CommCare using reports, and I'll show you an example of that. We also frequently, with really large-scale campaigns, see folks sending data to tools like ArcGIS or Power BI to conduct a lot of advanced analytics on the data collected as well. Often campaigns have GPS data, which can be used in ArcGIS. Knowing that it's really important to get that real-time information directly in CommCare, we've built a campaign dashboard that specifically tracks the progress of a campaign and is customizable. So again, a program administrator can log directly on to a specific campaign dashboard and add a variety of different widgets where they can track metrics. We know that the key indicators that we want to track during a given campaign differ. So this dashboard allows users to really customize that. We can view that information on a map. We can add custom reports to this dashboard. So here's how we might add more information. We can also export this report. Frequently we see meetings to discuss the progress of a campaign, like a daily debrief meeting where we want to review the results of the report. So the PDF is a tool that we might use there. And in addition, this video shows how it's possible to customize the dashboard. So here we're going to add a new sort of gauge module where we can add our own custom indicator that we want to track just for this campaign. So in this case, I'm going to track number of forms submitted. Once I save it, I refresh the dashboard. Now I can track the number of forms submitted. There's a huge amount of data being collected in CommCare during a campaign, and the purpose of these dashboards is to allow users to really flexibly and dynamically add more information so that they can understand and monitor the progress of the campaign. And then the final step, I know we've been talking a lot about this today, is paying workers for the activities that they've conducted. So there's a couple parts that are happening in CommCare here. First, based on the attendance information, we're calculating how much each of the workers is owed based on the activities that they've conducted. We also are able to directly facilitate and prioritize the payments and make sure that it's as timely as possible. So this is an example of payment verification report. We can filter by verified or non-verified workers. We can filter by batch number, and we can also filter by whether the payment request is pending, if it's failed, or if it's been completed. This report shows us a lot of detail about what payments have been scheduled, and we can click through and queue up which payments we'd like to disperse. So you can see that these payments have been requested. Once I want to click OK to confirm I want to proceed with the payment, we say that it was successfully submitted, and now these payments are pending. So in this case, this example is built for payments in Cameroon with this is integrated with the Momo payment gateway, Vodacom payment gateway. So it's possible to have that same look and feel for any payment gateway. We have to sort of make some tweaks on the back end with our APIs, but that workflow of queuing up what payments are owed, an administrator selecting who should be paid, and then dispensing the payment directly in CommCare is a workflow that we're really excited about to help decrease that time to payment. And this is just a screenshot because I know it went by quickly here, but again, this report is totally customizable. We have the KYC status included on the report, so when we're getting ready to dispense payments, we can confirm whether or not someone has been validated. We have who the user is that conducted the verification to make sure that we have that good audit trail that we were talking about previously. And we also have the ability to toggle the currency here. Again, the polio project in particular is deployed across so many different countries. We want to make sure we're able to accommodate different currencies and those transactions. So we're pulling information from the mobile money provider and also calculating that currency information up front during the campaign. So I know that was a lot of information, so I just wanted to kind of go through at a high level that overall workflow that we went through. We generate the micro plan, and in this case, we're kind of geospatially looking at where to best optimize the workflow and how to recruit a workforce that is geographically located near the folks who are targeted for a given campaign. We recruit and enroll workers and train them, verify their attendance. We conduct KYC checks. Then we enumerate the campaign itself, monitor and adapt the campaign progress, and finally pay the workers. A lot of these steps have been deployed at various locations, specifically with WHO. So each of these components has been deployed in different places, and they've been localized or kind of customized, but the core of what I kind of went through today is available to be deployed in any one of these countries. So you'll notice workers have been paid directly in Cameroon. We're doing KYC checks in Nigeria, microplanning in Tanzania, and enumeration in more than this. ComCare is deployed for enumeration in 120 countries around the world, but these are the ones that we've specifically been working with WHO on the polio campaigns. But I wanted to just sort of convey that the system is really flexible, but has been designed to really tighten that timeline. One of the metrics that we talk about a lot at Demagi is the WHO has done research demonstrating that 80% of campaign workers really want to be paid digitally, and that's really motivated us to make that process within the software as easy as possible to kind of do our part to help decrease that time to payment. So, I think this is just the summary. I think we already talked about this a little bit with polio, with the overall program, but this ComCare workflow that we went through has been deployed in 17 countries with more than 20,000 users. That's really exciting that I have to update this with 3 million plus workers enrolled. Our information is a little old. 96% of workers surveyed said they wanted to receive subsequent payment via mobile money after interacting with the campaign solution. So we're really incentivized and motivated to hear from those workers and make sure that we're meeting them where they're at and continuing to build the software to do that. So with that, I'll hand it back to you, but happy to answer any questions as we go too.
Questions or comments?
Excuse me. The recording.
No. Oh, there we go.
Yeah, thank you for that wonderful presentation. My name is Jen Katanu. I'm from Kenya. I have so many questions. If you could allow me,
Yeah, definitely.
from both of the presentations. My first question was, especially on the 99% first attempts, 99% success rate at first attempt. What would you say is the critical part that ensured or has ensured that happens? Then from the first presentation, if I could just go through the questions I have, we've said that WHO has done this process in the 47 countries.
No, I can answer the question, but all right. So we have coverage right now in 30 countries, but we've paid people in 22 countries. 47 countries is just our geographical coverage for WHO African region.
Okay.
Yeah, but we've engaged them by notifying 47 countries that we're going to do that switch to digital payments. Yeah.
Yeah, I'm a bit disappointed I didn't see Kenya. Is Kenya one of them?
We're doing a campaign right now in Kenya. We paid almost 100,000 people in Kenya for the last polio campaigns. Yeah.
All right. So which you say this is owned by the Minister of Health? Kenya, which department?
So this is with EPI. So they're the ones that are doing the immunization programs at the Ministry of Health, so the routine immunization for polio specifically. Yeah, but we work with the national level, so we work with the permanent secretary all the way down to those who work at the health facility level.
Okay, that's good. The reason I'm asking that is I know currently there is a digital platform that is being piloted for the community health workers, and I've not heard about the database for that, but I also realized that this one is for the community health workers, but who you're working with is nurses for the polio?
For polio, it's both. So we have community health workers that we leverage, or even have volunteers, and then we also have the Ministry of Health staff. So we have those that sit at the national, county, sub-county who work for the ministry, and then we have those that have been recruited specifically for the campaign as volunteers.
Okay, great. And the other question was around that you have training courses. Are these also available for people who are just interested in seeing how the digital payments platform works, or definitely the design of the digital payment platform?
Yeah, definitely. I think right now we are focused on polio, but the expectation is that if there are other areas that we need to perhaps digitalize, or if there's other areas for potential collaboration. You just mentioned right now that there's a tool that's being used. I don't even I don't even know about that, but I think generally speaking, the idea is that we're supposed to provide support to the ministry wherever it's required when it comes to strengthening digital payments specifically, not just for polio, but for other areas as well.
Okay. So we have somewhere where we can download the training courses?
We don't have specific training courses. We leverage the country office to pay these activities, but we don't provide courses or trainings. We provide courses directly to the ministry itself, those who are managing the system.
Okay, great.
Yeah.
I just have two more questions.
No worries.
For the audit trail, I wish you could talk a little bit more about that.
Yeah, so essentially when we initiate payments, the idea is that we do it through the bank system for WHO. Let's not even just for Kenya, let's take another country's example. If we set up the mobile money wallet, we have the numbers of the workers registered in the database. So for instance, if I'm sending you money on M-Pesa, there's a confirmation code where I can track and trace the payment. So the database allows us to link all of the payments that have been made to all of the numbers, so we can monitor and see. That's when we say full audit trail. We know when the payment was, let's say, uploaded in the system, when it was approved. We have levels of approval in the country office before the money goes out. So that's a full audit trail. You know, from when the payment request was initiated all the way till when the payment went to the worker's SMS, we have a full trail of tracking that.
Okay. Thank you. Then I know that the kind of the end users here, they are nurses. For the community health workers, one of the things that we've realized is they share their mobile devices within the community. Is that a challenge that you have experienced with nurses?
Yeah. We've experienced people sharing mobile devices, SIM cards, all that, but that's why we have the KYC verification, right? So it's even if you share your number, we know that that number belongs to someone else, and so if someone else registers using their name but your number, they're going to get rejected because we know that it doesn't belong to them. And so we also make sure that the same numbers don't appear twice, so it looks like two people are collecting, one person's collecting double payment. So those are routine checks that we do. And again, this goes to the first point you made about the 99% success rate and how we were able to do that. Is it's all in how clean of a database you're able to gather and what rigorous checks you put in place. So the more effort you put into establishing a database where you have clean data, where there's no duplicates, there's no numbers being shared, we have a clear indication of who passed KYC, who failed KYC. If you build that robust database, when it comes time to initiate payments, your chances of errors are going to be very minimal. You're going to be left with very little payment exceptions. So in your instance, if you share a device with someone, that's going to be flagged at some point and the payment won't go through because it's going to be one person using two numbers.
Okay, thanks. So what we've seen most of the time is you'll find that I'm a lady and I'm using the household's aid phone number, and when the money gets there, of course, you hear instructions, write the name of your husband, for example, or the name of the name that has been used to register that line. But when you go down, if the money goes to my husband, for example, and he doesn't give me my money. So that has been one of the challenges that we've been experiencing, where this line belongs to the head of the family who has not done the work, but is not able to, more or less the problem that comes with sharing of the the mobile phone number.
Yeah, even for us, it's not just in Kenya. We've encountered that in many countries. And so, are you talking about the SIM card itself or the wallet, the M-Pesa wallet? Because we can also validate who owns the M-Pesa wallet as well.
Well, I don't know what the wallet here means, but what I mean is if my Safaricom line SIM card, if I'm registered with it, with my name, that's where I receive my money.
Yeah, that's your wallet, yeah.
Then that could be the only phone that, SIM card and phone that is being used in my family. So if my son wants to be contacted, we'll use the same line. If my son needs to be paid for an activity that has been done, then the money will be sent through that. So my question was, when you run those and you realize that their names do not map to the person who actually did that, do you withhold that funds, or
we don't like to use the term withhold. It's not, I mean, there are instances where that happens and we have to come up with a backup plan. So that's why when we were doing the enrollment in some countries, we pre-register the workers. We don't wait until the campaign comes to initiate the payments, because that's the last minute. So what we do is we work with the ministry to register and enroll. Sometimes we also issue SIM cards out. So we have an agreement, let's say with Safaricom or whatever, in our contracts to issue SIM cards to register workers for those who don't have a line in their name, right? The other alternative option that we use, which is facilitated sometimes through the CompCare app, is you get consent. So you have a waiver, a liability waiver. So let's say the worker comes, they have their ID, they say that's my number. You do the verification, but they also sign and say, that's not my number, but I opt to receive funds into that account. That way, there is no liability when it comes to initiating payments, and we know that when we pay, we can't hear about, oh, I didn't authorize you to do X, Y, Z. It's not perfect. There are some countries where we haven't been able to do that, but it's a work in progress. We just have to work with the mobile money operators to see how we can best fit people into the database and to not exclude them. And yeah, that's it.
Thank you. I mean, this is excellent work. The reason I'm saying this is we've tried, there's been a lot of challenges.
Yeah.
So I mean, that is...
You definitely, if you'd like to engage with the EPI colleagues in polio, I don't know if you, I'm not going to give out names, but at the national level, at the EOC, those are the people that we are working with, and they've granted us, I mean, we've done five campaigns now, and we paid close to 100,000 people. And like the last campaign we paid in Kenya, 100% of the workers in 4 counties within 10 days.
Yeah, fantastic. I will actually reach out to them. Thank you.
Yeah, you're welcome. Yes?
Thank you so much. So this is the platform we're using it for digital payments. And in case the country is using other platforms for the other activities, campaign activities such as enumeration, and how the two systems speak to each other, or completely you just work on payment and the rest you just...
Yeah, that's a good point you brought up. That is the issue we're encountering right now, is how do we seamlessly integrate this system into the overall campaign roadmap, right? And we haven't done it yet. If I'm being honest with you, we haven't, because we kind of are using payments as a separate tool, as a modality. But we've realized that digitizing payments is not just the act of paying, you're digitizing the whole process. And so currently right now, we are working with other partners. I think they're here called eGov as well. And so eGov is developing this campaign management tool that's managing everything from the micro-planning to the overall activities that are included in things outside of payments. So we haven't done it yet. It's still a work in progress, but our focus is just making sure payments go out. Yes.
Yeah, just on sort of the overall data interoperability side as well. CompCare interoperates with just about every technical provider that's here, so it's been really great to have the chance to catch up with some of them. But we really frequently see folks collecting data in one system and then bouncing it into CompCare and then doing the last part after that. So an example of that is DHIS and ComCare are often co-deployed. Folks use DHIS for their reporting purposes and ComCare for the enumeration activities. But there might be cases where the enumeration is conducted in a different application like ODK or COBO toolbox, and then that data lands in ComCare for the data warehousing purpose, and from there the payments can be triggered from ComCare. So I definitely agree that looking at the full ecosystem is really important when we're thinking about a payment tool or the payment integration, but I do think that when we look at the full digital system, all the tools that we can use for a campaign can kind of share the data amongst each other. I think one thing that is really specific to payments, and I hope you all take away from this, is that it's really customized by deployment. So I showed you like a really generic version of this, but there's a lot of customizations for the country context, for the mobile money provider, for the workflow, the validation, like all of those things we need to tweak. So that's definitely something that we could work with you on designing and making sure that the tools are interoperable. Yeah.
Yeah, thank you for the two great presentations. I have some questions. One is to the WHO, and for WHO, you mentioned that you've been able to undertake a number of payments. What I wanted to know is, in terms of the flow, is for the payments, particularly for Kenya, were they done through the DMARCI platform, or these were done outside the DMARCI platform? The other component is which service providers have you been able to integrate with for the mobile payments in Kenya? I know there is M-Pesa, there is Airtel Money, and there is I don't know if Telecom is still functional, but it's part of the service providers in that space.
I think so. For Kenya is a unique case because Kenya was supposed to be the lowest hanging fruit. You know, this is the home of M-Pesa, and so when we first came into Kenya, the idea was to integrate ComCare into the payment process. However, we didn't achieve that. We encountered some resistance from the government because we didn't want to just go full steam ahead with ComCare. We said, let's just start with the bare bones. Let's see what tools we can use to sort of build the database while we maybe transition eventually over into a tool such as ComCare. So if I'm being honest with you right now in Kenya, what we've done is we've designed customized templates for them. So we have a data analytics tool at the WHO, and their role, and they're on my team, the role is for them to sort of be the back-end support, not just to manage and to synthesize the data, but to also help us manage and create tools that can be used potentially outside of ComCare. So if you're talking about Excel, for instance, we designed customized templates where you can put the names, the numbers, but you can also just select the role of the worker, when it comes time to attendance, the number of days that they've worked, and these are locked and managed by us, so there's no manipulation. That way, there's one harmonized approach on all the tools. Let's say if Mandera and Garissa submit data to us, it's all the same formatting, the same titles. The only way that they can change the data is just the name, the first name, last name, and the mobile money number, and that's it. And so once they send that to us, we do our analysis in the back end, and then we also have them collect the attendance, the number of days worked. They send it back, we check against the budgets, and if everything's good, we do we generate the payment file. And so what we do is we now are partnering with Safaricom. However, the issue with Safaricom now is that due to data privacy regulations, we're not able to verify the numbers. That's the issue that we face in Kenya. So a lot of the times the numbers that are being provided, we can't determine for sure if that's the person who belongs to that M-Pesa account. What they in fact asked us to do, Safaricom, is whoever is being registered, you need to WHO collect individual consent from every single worker. You can imagine if you have a campaign with almost 20,000 workers and you have 1 month, that's going to be impossible to do. So right now we're trying to influence policy. We're trying to go to the Data Privacy Commissioner to see if Safaricom can waive that or give us an exemption to do that. However, in Kenya, we kind of just use a simple Excel tool. We have also WHO teams stationed in the field. We have right now people in Mandera, Garissa, Marsabit, and Wajir. And their job is to support the task force that we established. We have a Ministry of Health task force at the national, county, and sub-county, and their job is to just focus on digital finance. They register the workers, they verify the budget, they send it to WHO Kenya, then we do our checks, and then we do the payments. So that's the process in Kenya, but keep in mind, this is not the gold standard process. We have countries where we've used extensive tools like Dimagi or Comcare where we can verify the KYC, and in Kenya we're not there yet. Yeah, and I think you asked another question about the provider. For right now, it's only Safaricom because we're paying through the bank, and so the bank that we have, which is Standard Chartered, can only pay into Safaricom wallets and not Airtel wallets.
Thank you very much for that. I think maybe just a comment, and this is something that you can be able to explore because for the malaria massnet campaign that we did last year and the previous year, to be able to ensure that we capture the correct phone numbers, we did deploy USSD so that when the users dial the USSD, you're able to get the phone number. So with that, you just ask them to put in their names and then be able to complete the registration process. So that's a way that you are able to address the issue of capturing the correct phone numbers. But again, there is still a challenge because I can be able to use maybe my sister's or my brother's phone number and be able to get in. So, but I think you've responded very well to that. And I think, like you mentioned, Kenya, there's still some processes, and there are several partners, and partners have their existing systems. So trying to probably consolidate all of them into one port might be a challenge, but it's a good starting point.
Yeah.
Because I think you mentioned something about double reimbursement. Someone is in this meeting for WHO and in another meeting for maybe another organization for the same day, which is really not possible, but it happens. But again, if all this can be centralized, then we can be able to manage the little resources that is available. But thank you for your response. Maybe just a quick one to the Dimagi team. And I think you've already been able to give an into that, is on the verification in terms of the KYC. I saw on the platform that you are doing the verification, that is the verify process. So I don't know, I think you've mentioned about, is it where you've been able to make payment is Nigeria, correct? Yep. So does it mean that for Nigeria, for the KYC verification, you are able to link to probably a central repository for the identification of those workers or numbers? There's a question on that.
Yeah. We actually do USSD verification in Nigeria, specifically because there were connectivity variations. In Nigeria, we use the Excel method, where we send an Excel file of validated numbers. In Cameroon is where we're directly integrated with the payment provider, where we're can click verify and send the information. So we treat the KYC verification process as a separate step than the payment process, and so in some places we're just doing KYC, in some places we're doing both KYC and payment. So in Nigeria we're just doing KYC, Cameroon payments as well. Does that answer your question though?
Yes, it does. Thank you.
But we have seen good results with the USSD app, so users can be enumerating in Comcare, and then Comcare can open the USSD app, they can enter their information in the USSD app, and then they're sent back to ComCare, so users aren't kind of fumbling on their phones opening two apps at the same time. We've really integrated those so that USSD app can act independently, and that has been a good solution in places where there's really low connectivity.
I'll probably need to have a quick check-in with you.
Yeah, definitely.
Also, I think in Nigeria, keep in mind when we talk about digital payments, and Nigeria is a special case, we're not only talking about mobile money. I think in Nigeria you've done the USSD call out for the bank as well with the standard. So we're able to just do bank payments as well as mobile money payments. So it's not limiting people to just one payment modality that we're also able to verify as well. Yeah. Yes.
Yeah, maybe something I forgot. You mentioned about collaboration with Global Fund.
Yes.
Which particular countries are you working?
So we have 4 countries right now that we're targeting for a pilot, number one, and for various reasons. These 4 countries were picked specifically because of the extensive experience that WHO has, the engagements with the ministry and their receptibility, but also the ecosystem as well. So the 4 countries were Cote d'Ivoire, Tanzania, Ghana, and the fourth one, sorry, I need to double check what the fourth one is. But for now, Ghana, Cote d'Ivoire, and Tanzania are the priority countries. Yeah, for a pilot. Yeah. Yeah.
Thank you.
Thank you. I don't know if we have time for the exercise. Yes, so we could go until 4:15. What time is it? 4 o'clock now. Okay. All right. Awesome. Okay, so I just have a very quick exercise, or really a discussion. So we talked a lot about, what are the steps to implement a digital payment system, what is our experience in implementing, but I really want to focus on a key topic here that us, even at WHO, are encountering gaps with, and when it comes to sort of like scaling this, and it's the idea of sustainability. And the question therein lies, how do we're setting up all of these sophisticated systems, but the question is, how do you institutionalize the use of digital payments, not with WHO specifically, we're talking about the Ministry of Health. How do we equip them and help them manage these systems sustainably, where we have a future where there is no support from WHO? And so let me just quickly attach my... So we just have 4 key areas we want to focus on for the purpose of this discussion, and just sort of also so that you can have some takeaways as you are perhaps encountering issues in these areas when it comes to sustainably managing and deploying digital payment tools. You're seeing these, these are the tools that we're sharing for Wajir County for the payment of the campaign.
As it does that, I just wanted to find out when it comes to in the system of approval, do you, because I reckon there are different layers of approval, does the system provide notification? Let's say there's a chain of 5 people that you're supposed to approve a payment. Mm-hmm. It happens a whole lot. Someone has uploaded the information, and the next person to approve takes a bit longer.
Yeah.
So does the system provide that element?
Yeah. So as you can imagine, there's obviously going to be quite a few levels of approval when you're talking about how much money being dispersed, but we do it through the bank. So the bank system, especially with Standard Chartered, is able to create users and to create approvers. And so what you can do, and I'll take it as far as even going, I don't know if Kenya is a great example, but Tanzania, we do everything through the Vodacom platform. So Vodacom came to the office, they set it up, they created the users, we have the file, the payment file, you upload, you can do the KYC verification, and once it goes through for approval at WHO, it goes through 3 or 4 levels, and every user gets an SMS or an email that there's a pending batch. And so they have to act on it. Obviously, there are sometimes delays where somebody's on leave or it's late at night, but we have reminders for people to go in and approve so it doesn't cause any additional delays. Yeah, and then in the case of Kenya, it goes all the way up to the WHO representative's final approval, and then the funds go directly to the workers. Yeah. Okay, sorry about that. So back to the discussion. So when we're talking about sustainability, we sort of drew out 4 themes, key themes that I'd like us to sort of focus a bit of the discussion on. The first one is capacity building. The second one is resource allocation. The third one is integration with existing systems. I think we kind of touched on some of that a bit. And then the fourth one is stakeholder engagement. And so these are the key pressing issues that we've seen repeatedly throughout implementing these systems. And so I thought maybe we can have a quick discussion on answering some of these questions. And the first one being, how can we build the capacity of local staff to manage and maintain these databases independently? So keep in mind, the key focus here is local staff. We're talking about those who work for the Ministry of Health, those who we've trained on how to manage the systems. But just wanted to see if anyone here has potential ideas on how we can build and enhance capacity for the ministry to manage this independently without WHO in the future. So to give you a bit of an idea, so we can have here, so we discussed training programs, right? So we only do, we have workers that enroll and register in courses for digitizing payments, but more than that, giving them hands-on training sessions on how to use and manage these tools. For instance, if we're doing training in Benin on how to roll out ComCare, we dedicate training sessions to to help these workers walk through some of the workflows, how to manage them. It also allows us to have, first-hand engagements with these users of these tools, right? We also explore partnerships with educational institutions for formal training. Sometimes we have people that are expertise in these areas engage with the Ministry of Health to provide them additional training and sensitization on the positives of using these tools. But what other long-term strategies do you think we can do in terms of capacity building when we talk about capacity building?
Just an idea. I don't know how other organizations approach this, but I'm wondering whether before you set up the a database, whether you do I'll call it a needs assessment, or basically to understand what does the Ministry of Health have in terms of a database, who manages it, basically like the resources around it, the gaps around it, whether they can be willing to have that integrated as part of their data warehousing. And what I've seen over the years we've been here is when we start from there, involving the Ministry of Health or the relevant government arm, then we somehow manage to let them start driving it and owning it.
Yeah, I think that's a really good point, and that's what we do generally during the advocacy period. When we first engage, we sort of do a mapping exercise, say, what are the existing tools in place, what are the databases? To be honest, most of the time, the issue that we face is the focal persons that we have at the ministry are not sometimes aware of what the tools are in another program, right? So polio is very focused on polio, malaria is doing what malaria does. So we have tools that are being used that are not communicating. And so a lot of the times you find that, okay, we can use the existing infrastructure, but sometimes it's already at capacity, or sometimes it just it's not feasible with what we're trying to do. So let's maybe see if we can build on that, or maybe start a solution that's more customizable. But what we can do right, to sort of like broaden that is and this is where you'll know how you get the best information from the ministry in terms of that mapping exercise, is having a task force. Right? You have a dedicated, because the Ministry of Health as it is already at capacity doing these specific activities, so you don't want to add more to their pile by getting them to sort of manage the system. You have to equip them with the tools as well as the specific directive to have a focus on digitizing payments. And so in Kenya, what we did was we even took it outside of polio. We said, let's have a national digital finance task force. These are people that have been selected at the ministry, and their whole focus is their training is around doing the registration, doing the attendance verification, doing the follow-ups, wherever those issues come up in the counties, liaising with the counties as well as the sub-counties. And so through that activity, we were able to hear from the task force, oh, well, this program is using this tool, why don't we integrate it into that program, So that's a way of doing it, is having that capacity for them to sort of manage the system, but then also having that information sharing exercise going across the board. So okay, let's go to the next one for the sake of time. I think we'll go to the next one, which is resource allocation. We all know, especially in the current environment, that funding and resources are a very, very critical issue. But they're also a critical issue for sustaining the systems that we built, right? We don't want a situation where, we have financial constraints, technological, or even human constraints. So I want to ask again, what resources do you think are necessary to ensure the sustainability of these databases? Do you think it's more focused on financial, technological, human, or just a combination of both, of three, or even more? In your experience in digitizing payments, if you have.
I think personally, it's human resource. But just briefly before I go into that, capacity building. One critical area there for me is co-creation. A lot of times we come with systems, and we want countries to co-opt them. And my experience with not just national staff, they already know, so they don't want to feel like they don't know. So involving them in co-creation processes brings in the element of ownership. And once ministry staff own up an initiative, it's always successful. Mm-hmm. If they don't own up, whatever money you throw at them, it won't go anywhere. But resource allocation, in terms of human resource, I'll give an example. If the staff have the capacity, if they have the skill, then they can easily cascade it, irrespective of even if there's no money, let's say to conduct an in-person training, they can have an online training, And so for me, that's the element of human resource is very important, having the right people in the right place and making sure that they have the right skills and the right mentality, definitely, to be able to share across the platforms would be important. I'm not negating financial and technological, but I think human resources is a little bit high up there.
Yeah, I know. I completely agree, because it's not like you just come and you train for a one-time activity. I think you have to have, and we do have those cascaded trainings. You people, if you train them at the counties, then they can travel and they can train the sub-counties and do that cascaded waterfall method of training. But also, it's routinely training. We have changes that are made to campaigns, how campaigns are run. We have changes that are made to even ComCare features all the time, so that require us to sort of have refresher trainings on how to do this. And then also the realization that people go and people come. People are not sitting there at the ministry doing what they're going to do for the next number of years, but we need to ensure that you have a contingency planning to ensure continuity for the future. But also, for instance, let's talk about technological. I think an area of allegation, we talk about how to build and sustain an enabling infrastructure. So we have a situation where the ministry doesn't have the technological capability. They don't have the tools and the resources, the servers to manage this data. So we have to put a lot of resources into building that enabling infrastructure, and that's where ComCare comes in, and that's where eGov comes in. And it's not only ComCare and eGov, but we have other players, even at WHO, who are doing the data management, but we need to sort of figure out how to allocate those resources to the ministry so that they can do it themselves. And that's why in Benin, for instance, the ComCare tool that we built is being managed internally by the ministry themselves. You know, in other countries, we do it via the country, WHO country office is sort of managing the tool, but having that dedicated focus on building that enabling infrastructure within the ministry is very key. And again, financial is obviously one of the areas to consider, considering the environment that we operate in. But I think financial is important also because right now our donor, we only have one donor, that's Bill and Melinda Gates Foundation.
Travailler avec nous. Donc l'OMS voudrait insister pour avoir des financements durables en ayant des donateurs diversifiés. Parce que quand vous avez un seul donateur, il peut venir et dire nous avons maintenant une orientation différente de la vôtre. Ce point ici, on doit laisser tomber. Alors il faut que nous puissions diversifier nos donateurs. Voilà pourquoi dans l'engagement avec Global Fund, nous avons pu avoir plus de financement pour ces projets. Et nous avons même plus de financement à travers NTDs. Nous avons signé maintenant un accord de subside avec NTDs. Donc on doit voir comment engager les donateurs. Quand nous allons sur des plateformes digitales comme ça, c'est aussi une manière de pouvoir attirer les donateurs et pour qu'on puisse attirer plus de financement, n'est-ce pas? Alors, je crois que vous n'avez plus que 5 minutes. Qu'est-ce qu'on peut faire comme intégration dans les systèmes pays déjà, et des systèmes qui existent au sein des pays? Comment on peut se rassurer que notre base de données est déjà intégrée dans les systèmes de gestion d'information du ministère dans le pays? Il y a des mêmes données qui sont en train d'utiliser par
data collection information that we could use for payments, but we don't know that, right? So I don't think there's a one-size-fits-all answer for this, but I just wanted to see if anyone here has experience in integrating payments into existing systems or really integrating any database into an existing health system.
Yeah, I just want to say we don't have the experience yet, but it's something that we are working with the Ministry of Health Kenya to see how we would integrate the community health workers registry with the community health promoters performance. I should be really curious. I'm really curious to hear whether that has been done before anywhere else, as in like any experience they have with that.
Integrating this into the larger campaign, no, I'm not sure if oh yeah, actually. I think I sometimes don't know what's happening in other countries because we have other focal people, but I think you can.
Yeah, we see this quite often actually, where a country has started running campaigns and they want to move that into their health information system, or the opposite, where countries deployed ComCare as their EHS system, electronic community health information system, and then want to use that data to then run campaigns. So we've seen it go in both directions. The major advantage, well, there's a lot of advantages. Procurement is just once. The same system can be used twice. Training, financially, there's huge operational efficiencies. But one thing specifically for campaigns is that households are already pre-registered, so things like microplanning are dramatically easier if we're already visiting those households for like an ANC or PNC visit, for example. So we have that information, then can use that to plan and execute a campaign with the same workers. So that system, like using the same system in both use cases, is a huge advantage. We've seen that happen in Ethiopia, in Benin, in Madagascar, in a number of places. Yeah.
Fantastic.
Yes.
Yeah, maybe just about an experience that we had for the Kenyan context with respect to the MassNet campaign is for the healthcare workers who are employed by the government. We were able to reference the government human resource system to be able to capture their actual job group. I think someone mentioned earlier today in the presentation, because for the payment of what we call per diems, it's normally capped on the job group. So, and sometimes when you ask the healthcare workers to give you the job group, when they know there is a benefit out of it, someone can give you the wrong job group so that they can get more out of that. But then with that integration with the government human resource system, it was able to address those particular gaps. But again, in terms of, I think integration is not really a big challenge at the moment, because most of the systems have got ability to exchange data with other systems. The only issue that can come in is convincing the various system owners that we need to be able to have our systems to speak to each other, which I think is it's a conversation that can be pushed forward. And again, part of that is with the data exchange, it reduces cost, because the data that you need to capture on this end, you don't need to capture it if it's available in another. If it's available in another system, you can just be able to reference that. Thank you.
Yeah, I think it's a good point. Also, I think something to consider with integration is also, it can be simple, but sometimes there's implications, larger implications, such as data privacy we've had, where, for instance, the KYC verification thing with Safaricom, we were able to sort of figure out if we can get access to their database to sort of verify. So there's a lot of issues that come up, but I do agree, I think at least when it comes to within the ministry, there's tools that are available for us to be easily integrate and to share information across the board. Yep. Yes, I think we're going to wrap up because we are well over time. I hope that this session was in somewhat beneficial to you. I guess our goal here is for you guys to also have some takeaways as you go into integrate digital payments as a part of like the larger scale campaign digitization process. But I hope that it was very useful and helpful. And yeah, if you have like any questions, I'm also available. Thank you. Thank you.
Ouais, merci.
This